Stop nursing. Today I am demonstrate foot care because my patient is suffering from diabetes foot for 10 years and
You washed your hand. What all the preparation are there?
I am preparing already my foot preparation.
Hand washing over.
Hand washing over and prepare my foot preparation, in preparation
and patient preparation. First, she is explaining the procedure to the patients, what she is going to do to avoid the tension. Maybe they, by looking at the articles, they will be thinking that it is like something big procedure they are going to do. So she will explain, just we are going to massage it and tell you that you can able to continue in the house. She has explained. Now the article she is going to explain. As such, the articles have a tray. One tray will be containing some Savlon solution, one bowl and one kidney tray, one paper pack will be there, and one having two jug will be, one will be the hot water, one will be the cold water, and the towel, Macintosh, and one more towel will be having, and will be emollients, will be having some of the emollients, and then one mirror. Importantly, you should have a mirror and one kidney tray. And one measuring cup we can have, and some nail brush is available, you can have the nail brush, and one coconut oil or some Vaseline or something will be available, that is called the measuring cup is available. First we can pour the hot water, needed amount you can pour the hot water, and you can pour the cold water. When you are pouring the hot water and the cold water, you have to check the temperature. Usually thermometer available. If your thermometer not available, this is the method. You have to check the temperature, not to be too cold and not to be too hot. And you can mix. You can have Savlon solution. If you are doing in a community, you can put sometimes turmeric. You can put salt will be available. That also you can put it. And you can soak the leg for 10 to 15 minutes. It will be better to soak. Meanwhile, you can take some health education, you can talk to the patients, and
So you are how long
10
will
to
be
15 minutes
10 to 15
soaking
minutes?
that any wound, if it is there, it will be easy to clean it, or the nail you want to cut it, the nail will be easy to cut while it is soaked. If the leg is very dirty, in a community setup, you can tell the patient to go and wash your legs and come. For the mother or any old woman, if she is coming from the farming area, she has a severe leg pain, that time also this diabetic foot massages alone can be done it. So now she has soaked it for the 15 minutes. Now she has removed it. She would like to cut the nails. See how she is cutting the bowl. She has got the cotton, so she kept the cotton under the in between the nail and the skin, so that she is make sure that it is not hurting the skin. So both the legs it can be cut it, so the particle will be present in the cotton itself. Then cotton can be thrown into the paper bag. Now already arranged Macintosh and the towel. In community, you can collect mobilized article from the house members. Now she is wiping with another towel. We had a 2 towel wiping. After wiping both the legs, so removing all the moistures. So make sure that it is so dry. If it is not so dry, you can put a little amount of the powder, or now she is having a oil, whatever the oil you can put it also. So it will be in between the fingers also, there will be water. So water can be completely removed in between the fingers. So
Why she is applying the oil? Anyone can tell why she is applying oil? To avoid the friction. Yeah. So can you explain and apply both? Yeah. What is this name of the stroke? Apply first. First is called stroking. How many steps you will do? 5 times you will do. So each leg 5 times. So you will complete one leg completely. This name is called stroking. Okay.
she can do it from the lower leg to the upper leg. So from the lower leg to the upper leg, if you are doing the massage in a circulatory motion, either the stroking or kneading, whatever it may be, the circulation will be improving. Venous return will be completely improving, and this is the way you have to do from the lower leg to the upper leg. Completely finishing the 5 times to the one leg, and then she can do the next leg. That will be better. So everything she is doing the 5 times, either the circulatory motion or kneading from here to here, the 5 times is doing. So she is giving only here. Sometimes till knee you can give the pressure also. This is a thumb stroking. Thumb is a pressure points. She is particularly giving to the pressure point, each with the both the thumb. She is giving a pressure. When the patient is having a severe edema, it should be avoided. Otherwise, the pressure can be given. It will be much helpful to relieve the pain and improve the circulations. Especially the diabetic patients will be having the much pain in this knee, not sole. The sole will be very comfortable for the patient. Then 5 times to the one leg, and will be the another 5 times to the another leg. You can completely do it. You are doing each leg 5 times. So what will happen when you are doing 5 times? In between you need some of the oil or emollients or some cream. It is insufficient. If you feel the leg is dry, in between you can take some oil. The another thing you have to maintain is your body alignment, your position. Otherwise nurses will be more chance to get the back pain. So your center of gravity, where it is falling, you have to give your body in a correct position and posture. It is very important to prevent the back pain.
Stroking in a tendon. Stroking between tendon. She also using the same thumb finger has been used, but the stroke in a little difference is there between the pressure stroking and this stroking. You could see the difference. So in between, if she feel that is friction, oil is not there, in between you can put some more oil also. Because the skin is becoming dry, it will be discomfort to the patient. So 5 times is doing. Next leg. Next leg also 5 times. What is the name of the stroke? Stroking between tendons. So the leg is made up of, body is made up of muscles, tendons, bones, tissues, cells, and blood supply, nerve supply, all these things. All are getting stimulated. Clear? Yes. What is that called? Pressure. So, pressure on arch. So arch of the leg you are giving the pressure. Okay. How you are using both the hand, palm is being used, giving much the pressure by the. So body of the nurse has to be aligned properly. How many times she is doing? 5 times. So this is good for muscles. The last one is for the tendon. This one is good for the muscles of the patient. Okay, next leg. 5 times. Yes. See, when you are doing this leg massage, you have to involve the family members. Are you understanding? Yes. Tell them, use the bucket in the house, that basin in the, every house will have. Use the ordinary salt and learn the technique. Understand? So they will continue. The care will be continue at home by the family members. Very good. Okay. What is the next step is? Hold the foot. So using this like a fist. Knackling. She is telling knackling. She is giving next leg 5 times. Do you see the soul should be taken care? Soul, small infection. Actually, the person's nerves are getting affected when diabetic. So small infection, no sensation. It will become a big wound. Go for amputation. Understand? Next is? Yes. Next is? Hacking. Okay. That's good. Good. So she is finishing one leg and another leg. One leg, another leg. Good. This method is nice. Both legs are comfortable at a time. Completing one leg and going other leg, it's not good. This is way is correct.
Rotating movement of toes.
No, okay. What is this? Rotatory movement? Toes.
Clockwise
Okay.
and anti-clockwise 5 times.
Clockwise,
Yes, 5
anti-clockwise.
times, and anti-clockwise 5 times.
5 times. Okay.
Clockwise.
So you are doing each finger.
Yes, ma'am.
So it promotes the movements of the fingers. In the hand, what we will do? We will stimulate the smiley ball, make the patient to move there for the stroke patients, right? But here we are doing it. Next leg. So she is holding the leg in one hand and using the fingers clockwise 5 times and anti-clockwise 5 times for each and every finger. Right or not? Small finger to the every finger has been done it. Excellent, Pinky. Next.
Next, range of motion.
Range of motion. Yes. Very good. The ankle joint is being moved from the lateral side and from the flexion and extension side. Right or not? 5 times she is doing. 5 times she is doing. Yes. Very good.
And then last stroking.
Last stroking. You put some more oil. Oil is dried already. So patient feeling comfortable. You can second time you can put the oil. So this is the final step.
Yes.
Overall 5 times he is doing in a circulatory movement from the down to upper side. So it is called. It will be helpful for venous return. Are you understanding? This also will prevent the varicose vein. If they do regularly doing, varicosity of the vein will be prevented. If you are doing, some of the patients are doing a long time standing work. So this kind of massages will be really helpful. Next leg. Are you watching? Very good, Pinky. Very good. Are you feeling comfortable?
Yes, ma'am.
Okay. Show the mirror. Give it to the patient. Give it to the patient. She will see. What you will do? What you do? So motivate the patient to look at her own leg. You look properly. You looked it?
Yes.
Yeah. Okay. Then you can remove and all the articles can be replaced. Understand? And I will do the second hand washing. She will do the hand washing. Thank you. Thank you, Pinky.